Hi everybody, I just wanted to share some tips with us about how to keep our teeth and gums healthy, because I know that a lot of us are staying home these days and our schedules may be changed from before, and maybe we were supposed to go to the dentist for our cleaning but we can't, so I hope this helps. First, there are two main problems that happen, and that is that we can get cavities on our teeth. And the second thing is that we can see that the bone levels in our jaws and in our skull, they go down. So these two are the main problems. Why does this happen? Well, main problem is bacteria. Not all bacteria, but there's bad bacteria that will grow in low pH. That's where they will thrive if we have that for a long time, and when they have the sugar or the food that allows them to grow for a long time. So generally, we go to the dentist. We usually go every 6 months, so that's 2 times a year, or some people even go every 3 months, which is 4 times a year. That's for the people who are at high risk for cavities, or who have really low bone levels that they can't clean it by themselves. And this, I guess this is prevention, what we're trying to do. And if they have the cavities, then they'll go and do the treatments. What's ideal though is that we stay with prevention and we don't have to go back and fix problems that we already have. So two main things that we can do at home. First thing I want to talk about is oral hygiene. And then the second thing I want to talk about is nutrition. So what do you eat? When do you eat it? How long are you eating it? Or even drinks too. So to start with oral hygiene, we generally brush in the morning more willingly than other times of the day, because we don't want other people to smell our bad breath. But because our routines are changed these days, maybe we're just staying at home all day, it's still super important to brush your teeth. And of course at night too, before we go to sleep, to brush your teeth. And the reason for this is, as we mentioned before, we don't want that bacteria there for a long time. So this makes it, about every 12 hours we're going to clean up that environment. And I like to floss as I'm brushing my teeth before I go to sleep too. Because when we're going to sleep, I don't know how much you sleep, maybe it's 6 hours, maybe it's 8 hours, maybe some of you are able to sleep 12 hours, but that food, if we don't brush and floss here, is just going to stay there. And if we do that over and over again, that's really going to allow the bacteria to grow and to cause problems in our teeth and our bones. So to start off with floss, how we can floss, why we need to floss. If this is our tooth, you can't see this part because it's under. Oh my goodness, like but what we can only see is usually like up to here, and this is our gums. These are our gums. But we can't really clean this part with our brush. We're just focusing, on here. And so the floss allows us, if you have like a tape-like floss, you follow along the surface. And as you can see, the teeth, the anatomy, they have like a neck shape. So you want to go in a C shape and follow along the tooth surface. And it's not just in and out, but you want to get this tooth and you want to get the adjacent tooth. So that's why we need to floss and how we can floss. You don't want to go too deep to, cut your gums. But it is important to know that we also have pockets. We have pockets around our teeth, believe it or not, that we can't really see. And so another good thing is we want to have soft bristles on our toothbrushes so that we're not cutting our gums down like this. Then what happens is as they go down, the root of our tooth is going to show, and then you're going to get a lot of sensitivity, whether it's cold, sometimes even when you're not doing anything it'll be sensitive. And this is also where a lot of cavities can grow more easily. So we don't want to brush or floss too roughly, but we do want to want one that's soft, that we can kind of go into these pockets like this, just very gently. And we want to focus on one tooth at a time and then move on to the next. And even on a tooth, you know, they're not 2D, so this side will be easy to get, but then you might have to change the angle of your tooth. But yeah, the most I'd say that you could do is focus on like maybe 3 teeth at a time, maybe like this. But you definitely don't want to be doing this kind of motion and like really rough on your teeth. That's gonna cause that recession and that sensitivity. And moving on to nutritional counseling, when we want to drink or eat things that are acidic or have a lot of sugar, we don't want to be drinking them for a long time. We just want to drink them for a short time. Like maybe instead of sipping on your coffee all throughout the day, you want to finish it in 30 minutes. And if you have something like clementines, you don't want to brush your teeth right away, because then you'll be spreading all that acid and that sugar on your teeth. But you want to wait a little bit. And even better than candies that have a lot of sugar is snacks like cheese, because they're more basic. And yeah, but even if you don't necessarily eat things that are basic, in all of us, whenever we eat, we have saliva, and that's really good for us because it will return the pH back to normal, and it will break down the sugars. So that's why the saliva can do its job if you have it really short time, but if you're doing it all throughout the day, then there's no chance for the environment to be returned to where it's not good for the bacteria we don't want. And that's also why it's really important to brush and floss here, because when you're sleeping, you don't really have a lot of saliva. And there's not that much saliva then. So we want to have that clean environment already before we're going to sleep. And lastly, after you've done that brushing at night, do not snack right here before you go back to sleep. If you do, then please brush your teeth again. And yeah, that's pretty much it. I hope that this helped you out and that you don't have any pain from cavities or because your gums are swollen. So I wish you the best of luck with that. Have a good week. Bye.